So welcome to 8th NEET-PG 2024 recall question discussion. So starting with question number 71. So in the demographic cycle, B curve represents. So here is marked B is there. So this curve was asked. So this B curve, the blue curve represent. Yes, you are very right. This B curve represents here. This is death rate. So this is death rate. So here is this blue curve is death rate. This pink curve is birth rate, and this red curve is total population. So I think the question marked curve was the middle one, blue one. It is death rate curve. See the demographic cycle. Initially, in the stage 1 of the demographic cycle, it is high stationary phase where both birth rate was also high, this line, and death rate is also high. So the natural increase is stable, a slow increase. In the second early expanding phase of population, birth rate is still high, but death rate falls rapidly because of improved treatment. In the late expanding phase, birth rate falling, also death rate is also falling, but more slowly. Okay, so the number of total population increase but slow down. Here rapid increase, that is why early expanding. In the late expanding, as birth rate slow down, there is increase slow down. Okay, and in the late stationary, here is high stationary, here is late stationary phase. Both birth rate and death rate is low, and the population is again stable. And in the declining phase of population, there is birth rate is much lesser than the death rate, where the total number of population also decreases. So these are the 5 stages of demographic cycle: high stationary, early expanding, late expanding, low stationary, and declining phase. And this graph is obviously the graph B was asked. This is nothing but death rate. Initially high because of the better treatment outcome, in decline. Okay, so this is graph B, death rate. So recently I have started Harrison's simplified approach discussion. So already I have uploaded approach to unintentional weight loss, how to approach unintentional or involuntary weight loss. This was uploaded 1 week ago, and in subsequent classes I will again going to discuss different Harrison based topic. So kindly subscribe the channel for more such type of video, and also please subscribe the channel for the motivation so that I can make the recall videos as fast as possible. So subscribe the channel. Thank you. So coming to question number 72. Arrange the sequence of events in case control study. So among these 4 steps, which one will be the first thing in case control study? Obviously your selection of cases and control. So this will come first, number 1. Then among these cases and control, you have to match according to their characteristics. So second one will be your matching. Number 2 is number 2. Then after that, you have to measure the exposure of both case and control. So this will be your step 3. And lastly, after measuring the exposure, you have to analyze and interpret, and certain formula like odd ratio or relative risk ratio, etc. you have to calculate. So odd ratio. So this is number 4. So it is 4 is number 1, then 2 is 2, then matching, followed by measurement of exposure, followed by analysis of cases. So this is the sequence. Number A is the correct answer. Question number 73. I think so many of you were discussing about this thali. One such type of may not be similar image. In previous video, some of you were asking me why this is not the exact image. Even it's not possible for me to recollect the same image. Maybe some this type of image was given and some pointing was there like A, B, C and D. And as far as recalled by my juniors, one option was there, that is definitely over rice, and the question was related to rice. They asked what is the richest source of thiamine. Basically it is unpolished rice, but whatever the option was there, the better option will be always rice. Vitamin B1 or thiamine richest source is rice, so rice will be good option for you. Okay, comment your answer below in the comment section. Which of the following is contraindicated in iron overdose? It is British antileoside. Okay, so British antileoside or BAL is contraindicated in certain poisoning like selenium. Okay, then your iron, then your cadmium, and your organic mercury. Okay, organic mercury. So these are the uh, metals in which chelation with BAL is contraindicated. So for iron overdose, BAL is contraindicated for treatment. Okay, obviously desferrioxamine is the treatment for iron overdose. CT image is showing a cyst in the liver. Here you can see some detached membrane, and this appearance is nothing but your water lily sign, right? So this is water lily sign, suggestive of, yes, you are absolutely right. This is nothing but H cyst or hydatid cyst caused by echinococcus. So this hydatid cyst, they ask Garvey staging. Usually the WHO staging is commonly asked, but this time they asked Garvey staging. According to Garvey, the type 2 is fluid collection is detached membrane or such type of membrane separation inside the cyst. So this is Garvey stage 2. So the answer is Garvey stage 2. 76. Arrange the steps of disaster cycle in sequence. So let's look at the disaster management cycle. So here is your disaster. So this is the disaster impact. First there will be disaster impact. After impact there will be response to disaster impact. Then your this response is basically emergency relief. Then recovery is your reconstruction and rehabilitation. So first emergency relief, followed by recovery, rehabilitation, followed by mitigation or prevention of disaster, and lastly your preparedness or early warning for the next cycle. Okay, so this is the disaster management cycle, and I have written only one option, which seems perfect to me. So this the answer will be first disaster impact, then response, then rehabilitation, mitigation, and preparedness. I think some of you are telling preparedness was not there. Maybe first four options were there. So is impact, response, recovery or rehabilitation, mitigation, preparedness. So this is correct order of disaster cycle. So coming to question number 77, a man wears female heels and dress before having sex with female but not interested in males. So diagnosis, so definitely it is not homosexuality. He is not interested in opposite, not same sex. So homosexuality, this is not. Transvestic fetishism, absolutely, this is wearing of opposite sex dresses and attire. So this is transvestic fetishism. This is not gender dysphoria voyeurism. The definition is different, you can read it from your book. Question number 78, you are applying a vacuum to deliver a baby in a patient with prolonged second stage of delivery. So vacuum delivery, so the point at which the vacuum is applied, so this is vacuum delivery. Okay, so in vacuum delivery you have to apply the cuff here. See, this is the cuff. So this is your one fontanelle, this is your posterior fontanelle, and this is your anterior fontanelle, and this is your posterior fontanelle, and this point is called the flexion point or pivot point, and the distance of this point is 3 centimeter. Okay, from the posterior fontanelle, and from the anterior fontanelle to anterior margin of the cup is 3 centimeter, and itself this cup is also 3 centimeter. Okay, 3 centimeter. Okay, 3 centimeter, because it's 60 millimeter basically cup total. So basically, so that this total distance is 6 centimeter from anterior fontanelle, the pivot point or flexion point, but from the posterior fontanelle it is only 3 centimeter. So the answer is, so during vacuum delivery, so the cup should be applied 3 centimeter anterior to posterior fontanelle. Okay, is it clear? So it is theoretical question, not midway or 4 or 6. Okay, 6 centimeter anterior posterior to anterior fontanelle, the opposite answer may be correct. Okay, 79, a child was born after 8 months of father's death, and the grandparent filed a case that baby might not be their sons actually, but the DNA came positive. So definitely this boy is as DNA is matching. So what is the definition wise this child? So let's look at the definition. Posthumous child means child born after death of father, but mother being conceived by the said father dead. Okay, death of father already, but this mother is conceived by the same father. As here the DNA is matching, obviously mother is conceived by the same father, so this is posthumous child. Okay, what is supposititious child? This is supposititious child is when one belonging to the another person, baby of another person, produced by a woman for claiming on her own. So a woman is claiming another person's baby to be her own. So this is supposititious child. But death of father, but mother conceived by the said father is posthumous child. Here DNA came positive, so obviously they are blood related, but already there is death of father, so this is posthumous child. Question number 80, what would be the mode of delivery in images 1 and 2? The first image, you can see the twin baby, but for the first image, the first baby is in vertex position, right? Vertex. And for the second baby, it is breech. So it is breech position. So for the mode of delivery, for this image 1, for first baby with vertex, it should be NVD, vaginal delivery. Okay, so both baby can be delivered vaginally, but in this case you have to go for cesarean section. Okay, lower uterine cesarean section or cesarean section. So the answer should be first image vaginal delivery, second image cesarean section delivery. In the next segment I am going to discuss 81 to 90. So don't forget to put the all the comments about the remaining questions so that I can make video much faster. Thank you very much for your attention.